I think the most important guide, I think, is to manage all the vascular risk factors that we know contributes not only to the risk of stroke and faster brain aging, but also like faster brain shrinkage, but also to Alzheimer's disease. So that means hypertension must be recognized even at age 20, 30, 40, and treated vigorously. We have good medications now that can do that. Diabetes has to be recognized and treated as best it can. Cholesterol has to be treated. People should not smoke. People should exercise. And interestingly, aerobic exercise, even 30 minutes 3 times a week, appears to have a long-term protective effect. And there's a fascinating study that was done in older women in their 80s in one of the retirement home many communities in California. And they asked them questions about their level of physical activity throughout their life. And it turned out that there was a correlation between the amount of physical activity you had engaged in and your cognition, your cognitive ability at age 85. So does anyone want to guess which decade was the most important in terms of that protection? That's actually pretty interesting. What do you think would be the most important contributing factor to that protective effect of exercise? Teenage. Teenage. Think about what's happening to our teenagers these days, right? Teenage. But the good news, it's a bit like stopping smoking. Every decade, you have stopped smoking, you get a benefit. You get some recovery, you get some protection. So every decade counted, including the exercise in the 70s. So the message is, exercise is one of the most important things we can be doing. But heart-healthy diet, and social engagements and being mentally stimulated, all of those things are important. Education is an important protective factor, which is why social economic disparities are a problem. Bilingualism, interestingly, is protective. So there it's thought that people who are actively speaking 2 languages are constantly switching, and they're exercising their frontal lobes, and they're building connectivity and resistance to disease. Now, what happens is that this other paradox is that if you have more reserve, you have more education, you have more ability, at birth, something called intellectual quotient and so on, or you've just been mentally very active throughout your life. When you actually manifest Alzheimer's disease, your brain is actually more shrunken. So again, there's some ability to compensate that allow people to get further along in the disease before they apparently have a problem. So there are these very, very interesting paradoxes. Just like, with women, is it the packing cell density, in women's brain that gives them more efficiency? Who knows? We don't know. But there are important things that you can be doing right now. Now, I should mention that very soon, because we now have other kinds of imaging techniques that allow us to actually see some of the brain pathology of Alzheimer's disease, is called amyloid. It's a protein, a toxic protein that accumulates in Alzheimer's disease, and it's become the target of attempts to remove it or change how it accumulates. And so now we're at a point where there's enough concern that you need to start much earlier than when people actually have Alzheimer's dementia, and try to use some of the interventions that have not worked in Alzheimer's disease itself, dementia, at an earlier phase. And so there's actually a study that is being started in North America, and we're going to be part of it, where individuals who may have a family history or they may be concerned, over 65, will be invited to have something called an amyloid scan. It's a PET imaging scan. And it will tell you if you have amyloid in the brain, which means you are probably at risk of developing Alzheimer's at some point in the future. And those individuals will be given the option to be randomized in a trial to receiving an antibody that removes amyloid from the brain or is a placebo. They're going to be followed for 3 years, and then the goal is to see whether or not they're better off 3 years later and whether some of that amyloid has been removed. Because the thought is that eventually, if we could know that about people, maybe in their 50s and 60s, before Alzheimer's usually presents in the mid-70s, then we can start to prevent Alzheimer's disease in the same way as we manage diabetes or we prevent the consequences of hypertension. I should tell you that uncontrolled hypertension by itself shrinks the brain and actually shrinks it in the same areas that are affected by Alzheimer's disease. So hypertension control is absolutely essential. If there's no other message from today than that you should be exercising and have your blood pressure under control, I will have done my duty because I will be protecting your brain for the future.